Now that's an ulcer. So today I'm going to talk to you about diabetic foot ulcers. Hey, Dr. John here. This is probably the most common foot wound or problem we see with our diabetic patients is a diabetic foot ulcer. And what's the reason why diabetics get this? Well, diabetes can cause neuropathy, and if a diabetic patient's not controlled well enough, it can cause a breakdown in the skin. And what happens is that in an area underneath the foot, you can have a heavy callus buildup due to uneven pressures. And those uneven pressures causing this constant callus buildup will eventually break down the underlying tissues. And what's the problem with a diabetic foot ulcer? Well, the diabetic foot ulcer can lead to infection of the soft tissue, infection of the bone, and eventually an amputation. And so the goal as podiatrists, foot and ankle specialists, is to get this wound healed as quickly as possible to prevent that. That is what we call diabetic limb salvage. And this is probably the most important thing we as foot specialists can do for our patients with diabetes is to avoid amputations, which is a epidemic in the world, considering the onset of diabetes and the constant risks involved with amputation. So here I'm really just trying to remove as much of this heavy buildup of callus. It's fibrous tissue. This is non-viable or non-living tissue that doesn't have any blood flow to it at all. So all of this has to go, because if it doesn't get debrided or shaved off like I'm doing here, it will just promote further breakdown of the tissue and actually promote infection. And so taking the 15 blade here, I'm further shaving down all of this callus tissue because I want this wound to have the best optimal chance of healing. So after we remove this callus and this fibrotic tissue, the goal is to really get this wound offloaded, which means we want to remove as much of that pressure underneath this big toe joint. And I'll put her in a surgical offloading shoe, which will essentially float that area of the ulcer. That will help the tissues relieve a lot of the stress that has been causing the breakdown of the tissue underneath there. As you can see, I'm trying to make sure that this hole, this deep ulcer part, is not going any further, because if it starts to track or go deeper into the bone, that's a big sign that it's getting really bad. You can already see a little bit of redness around the ulcer, and so we want to make sure that there's no infection, or if there is some type of bacteria causing this wound to keep from healing, then we'll need to make sure of what that is. And I'll be taking a wound culture here. But the main goal is she has to have her diabetes under control. If her diabetes is not under control, this wound will not heal. So as podiatrists, we work closely with our primary care doctors, our diabetic endocrinologist doctors, to make sure that, one, her hemoglobin A1C is low, her diabetes is in check, and that will give us the optimal amount of healing. Also, her circulation is very important. So here we're taking a wound culture, so it's a swab, and this is a sterile swab. I'm making sure I can get into every little crevice there as possible so we can get a really good reading. And we'll send this off to the lab. The lab will give us back an idea of what bacteria might be in this wound, and then we can put on appropriate antibiotics. So what are the goals to healing? We want a regular debridement of the wound. We want to offload the ulcer. She's got to get her diabetes in control. And if there's any infection after the wound culture comes back, we have to get rid of that. We have to treat that infection. Hope you enjoyed that. Oh, but wait, there's an update. 3 months later, this is her foot. completely healed.
back on
She's
that
doing
at all,
great.
huh?
She's coming in every 6 months for preventative care, and she's happy. Hey, make sure you subscribe, hit that bell icon, and look for more videos. I appreciate your loyalty. We'll see you next time.